Yeah, thank you.
Actually, both of you, and we'll end up with you and the lady next to you. Go ahead. Go ahead.
My name is Anita Hinkle, and my name is Anita Hinkle, and I'm from Merrimack. There's so many things that we could say since we're a room full of common sense people, and that's very uncommon quality these days. The one thing I wanted to ask about this atrocious health bill. First, government shouldn't be in the health business at all. The one mission is the defense of this country, period. The second thing I wanted to know about this atrocious health bill, that I heard that they are sneaking through this slaughter solution, aptly named, that will just be done by a rules committee. No vote taken. How are they going to weasel that through?
They're not going to be able to do that because the Senate parliamentarian has said that we are not going to act on a bill that has not been actually passed by the House. So I think we've avoided that one. The question is right now, it's the same sausage making going on. The President and the Speaker and the Democratic leadership are calling these members over one by one, the quote, blue dogs, who never bite, by the way, they only bark, and twist their arms and try to get the number of votes. Yes, ma'am.
Thank you for taking my question. My concern is, what are we doing to stop the bleeding of the illegal immigrants who are putting an undue strain on this country and the healthcare system?
Thank you for bringing that up. In the last few years, 3 or 4 years, there's been an incredible change along our border, and that is that there is violence of unbelievable proportions. Thousands of people are being killed and murdered on the Mexican border because of the drug cartels. The drug cartels are in a struggle against each other and against the Mexican government. They are a threat to the actual existence of the Mexican government. They are so powerful. And I say thousands of people have been killed. People's heads cut off and their bodies hung from the overpass. I mean, this is a state of violence that is a great threat to spilling over into the United States of America. It is a threat. And obviously, by the way, we are the recipient of those drugs. $65 billion a year in the estimates of some. So we ought to be doing something about the demand for drugs in this country as well. But my point is, we must secure the border. We have to get it secured, and we do not have it secured. And I'm sorry to tell you that in the President's budget, there's actually a reduction in border guards along our southern border. That is unacceptable.